the reality is that in terms of a physical illness type of illness, anybody who puts it in those terms and says that a mental illness is just like a physical illness, you just have to ask one question. What is the physical test to know that someone is mentally ill? And there isn't one. There never has been one. So if you have appendicitis, for example, I could take a blood test and see that you've got a raised white cell count, right? And there's many ways, and if you have pneumonia, I could take an x-ray and see that you've got, some gunk in your lungs. And you could do that with pretty much any physical illness. With mental illness, there is no test. There is no way of discerning that somebody has this physical change going on. Wow. And there is a huge amount of debate as to whether or not there are actual things that are happening. Okay, there are different schools of thought around this, but there's no clear-cut answer. I went to a lecture a few months ago by the head of neuroscience at UCL, and he said we have to admit that in all our years of research we have never found any physical, actual underlying change, underlying specific causative element in mental illness. There are theories about dopamine and different hormones changing, but they are theories. Now, the theories came about from the fact that some drugs were having some effect, okay, and so the theories were reverse engineered from those drugs' effect being known, okay. But it hasn't been very specifically found then when they've looked into people's brains afterwards. So there's lots of debate about this, okay. And I guess the way I see it, that sometimes an illness construct or a construct that's a bit more biological can help people. Some people find some comfort in understanding that way. That's fine, and then it can work, okay? But other people reject it. Other people vehemently reject it and find that it doesn't help them. And so I think that working with people in a way that enables them to lead on how they understand their experience is very important, because we have to admit with some humility that we don't have the kind of technological certainty that other branches of medicine have. And because we don't have that certainty, then we can be in an uncertain place and allow others to do the leading. And it is about the person having the experience. So it's about how they see it. Some people are vehemently anti-diagnosis and anti-illness definitions as well, okay? But again, there are many people who have these experiences who really see that as important. And so therefore, who am I to say, no, that doesn't exist, So this is a grey area, and I think it's important for us to treat it as such. That's basically what I'm saying. Okay.